Hey, so you are probably confused about Medicare just like everyone else is confused about Medicare. If you are aging into Medicare or if you're 65 years of age and older, one of the questions that we often hear is, do I stay on original Medicare or do I go to a Medicare Advantage plan? What is the difference? In today's video, I'm going to walk you through two simple tips. It's going to be a reminder for you to determine what's going to be best for you, staying on original Medicare and choosing a Medicare supplement with a prescription drug plan, or understanding the difference of original Medicare as opposed to enrolling into a Medicare Advantage plan. Stick around, I'll be back in just a second to dive into these two tips and make you understand exactly what options you have available to you. Hey guys, my name is Kelby Hightower with Medicare Hub. I am the principal broker of an insurance agency that specializes in Medicare health plans. If you are following us for the first time, I would like for you to be able to take a second and like, subscribe, and then also share this content with a friend, family, or somebody else that's maybe getting ready to turn 65 or 65 and older. It's very important for us to be able to educate those that are 65 years of age and older about Medicare, your health plan options, and making things easy. As we like to say, we want to make your life easy by making Medicare simple, and providing this content to as many people as possible is a great way to answer simplified questions that are very complex and very hard to understand. So today I'm going to be talking about the first tip of how to understand the difference between original Medicare versus the Medicare Advantage plan. And one of the things I like to do is give a little bit of history, and I'm going to read a couple of things to you and explain what this means, how it impacts you some over a decade later, 2 decades, 20 plus years later of the government implementing some acts, implementing some rules and regulations, and what has that evolved to when it comes to original Medicare versus the Medicare Advantage plan. So in 1997, the Balanced Budget Act was passed. It was by George Bush. This legislation expanded options for private insurance companies to offer Medicare benefits through managed care plans. This is Medicare Advantage in the conception. So in 1997, this inception of Medicare Advantage or HMO or PPO plans became available. And then the evolution evolving fast forward up to 2006, significant changes were made to the Medicare program with the implementation of Medicare Prescription Drug Improvement and Modernization Act. The MMA of 2003 advanced to the 2006 Modernization of Medicare Act was performed, and that basically allowed Medicare Advantage or original Medicare to provide an option for Medicare prescription drug plan benefits. Now, why is this important to you? And why does it matter? Well, for some of you guys that have been educated correctly on prescription drug coverage, if you choose not to enroll into a prescription drug plan, guess what? And you enroll some months later or years later, you're going to be assessed on a penalty that began in 2006. So 2006 is when the 1% towards the national prescription drug premium average began. So if you've gone from 2006 to 2016 and you didn't have drug coverage, that's 10 years or 120 months times the national average prescription premium drug plan average for that year. Back then it was about 30 cents, 32 cents a month. The average at that time was about $32 a month in premium costs. And so you pay a penalty of 1% toward the compound accrued months that you did not have drug coverage. So why is that important? Some of you guys that have not chosen to choose a drug plan, it's very important because I would encourage you to choose a drug plan. Even if you're taking generic drugs and you go to Publix and you get them filled for $0 cost or $2 or $10, if you ever were going to be prescribed a name brand drug, which does happen, we don't have a crystal ball to look into the future to find out what is going to happen to my life 5 years from now, 2 years from now, 2 days from now, or even tomorrow. So if you have a catastrophic event occur, like a heart condition or a major chronic illness come upon you, all of a sudden you're prescribed a name brand medication, you could have several hundreds of dollars coming out of your pocket to cover the cost of that drugs. Now, sometimes pharmaceutical programs are available, sometimes reduction of cost in those drugs are available through the pharmaceutical company, but some of you guys have experienced extremely high cost of medication over the years, and maybe you're on an employer-based plan. That employer-based plan had an incredible drug benefit, and you're looking at going into a Medicare prescription drug plan or a Medicare Advantage plan, which we're going to get into in just a second, and tie into a Medicare Advantage plan and the importance of drug benefits in that. But the drug benefit is a huge catastrophic loss for people if they don't have a drug plan. And since 2006, the inception of this penalty was applied. So for those that are paying a penalty, understand that began because of this passing of this act in 2006. Moving forward, if you don't have a drug plan, you're going to be penalized 1% towards the national prescription plan drug average. And that can change every year. It's right around 30-something cents. It has been for the last really about 5 to 10 years. And it kind of ebb and flows, give and take, depending on the national prescription premium drug average. So you just take how many months that you have not had a drug plan since 2006. So if you turn 65 in 2015 and you've gone 9 years and you're getting a drug plan, now all of a sudden you're going to have that many years or that many months times, just figure about 35 cents. If you want to figure high, 40 cents a month. That's going to give you your penalty cost that you're going to have to pay to get that drug plan. Now, pay the penalty, get the drug benefit. Now, one of the ways to eliminate having to even pay for a premium for a prescription drug plan, if you're on original Medicare and you're watching this and you're like, hey, how do I eliminate maybe some cost involved in the prescription drug plan? A lot of people have chosen to go the route of the Medicare Advantage plan. Now, in 1997, that's when the inception of the Balanced Budget Act began, and HMO and PPO Medicare managed care model plans became available to the public. And these Medicare Advantage plans, what we call Medicare Advantage prescription drug plans, MAPD plans, are available for you. And a lot of times if you're in a rural area and you do not have access to doctors, hospital within about a 45-minute or an hour radius, if you're in Iowa, Nebraska, your certain states, Wyoming, and it's a very vast landmass states, you don't have a lot of access. A lot of times you may be in a town that's 1,000 people, 2,000 people, and there's not a lot of access to care. I would encourage you to look at Medicare, original Medicare with a Medicare supplement and a prescription drug plan. Make sure to get the prescription drug plan because you don't want to pay the penalty. Now, the versus of that is I am outside of the Nashville, Tennessee market, and here we have a huge mass amount of doctors, specialists, hospitals. Access to care is not limited in the market that we're in. So here we see about 85% of our client population end up enrolling into a Medicare Advantage plan because they can get their Part A services, Part B, what we call Part C benefits, also like dental, hearing, vision, all these additional benefits and what we call bells and whistles that are added into Medicare Advantage plans, but like dental, hearing, vision, over-the-counter benefits, food cards, all these different things that can be part of the Medicare Advantage plan, but also it's going to incorporate the drug plan. Now, again, if you haven't had a drug benefit from 2006 forward, however long you have not gone, you're still going to be assessed the penalty. The beauty of it is, though, with the Medicare Advantage plans that are in our markets, and most markets are going to be zero to low premium, typically zero premium. You're going to have a fixed copay cost when you access care. You're going to have a fixed copay cost for major things like hospitalization, surgeries, and things like that. And typically, you're not going to have a 20% fee that you would have with original Medicare. Now, for you guys that don't understand original Medicare, we have a link below for a Medicare Made Simple webinar, an on-demand webinar I provide that goes over the entirety of how Medicare works from A to Z, and it has a guidebook. It's a great way if you're getting introduced to Medicare and you don't understand any of this to watch that and then come back to videos like this to really understand penalties and things that you need to be aware of, because choosing a health plan is either staying on original Medicare and getting a supplement or going on a Medicare Advantage plan, which I'm talking about now, which is like an HMO or PPO. It's network driven. And if you're in an area where the networks are huge and robust, the plan options are usually really good and the benefits and copay costs are pretty reduced and low. And you can add on an ancillary product to a Medicare Advantage that cover the major costs like hospitalization and things like cancer. Those are the two major causes for out-of-pocket cost. And then those Medicare Advantage plans have max out-of-pockets. So that just means if you meet that at max, usually they're anywhere from $3,000 to $6,000, the max amount. So once you meet that, the health plan, the HMO or PPO health plan, Medicare Advantage plan you're on, has to cover 100% of everything above and beyond that. So why is this point important? And the tip really I want to bring home is two things. One, you're going to have a penalty towards prescription drug plans if you do not choose to enroll into one. Two, you have really two major options: Medicare, original Medicare, and go to Medicare supplement and then enroll into a Medicare prescription drug plan to eliminate the penalty, or you can avenue into a Medicare Advantage plan, which are going to be like HMO or PPO type plans, typically low, zero premiums, low cost copay out of pocket for routine stuff like doctor visits, specialist visits, a little bit higher cost for things like surgeries, inpatient hospitalizations with a max. And then they're going to have a drug benefit. Make sure you look at plans that are called MAPD or Medicare Advantage prescription drug plans, because we're talking about the tip of eliminating this Part D penalty. The Medicare Advantage plans that have PD or prescription drug benefit built into them will eliminate the penalty if you're going on to Medicare. Now, if you're not on a drug plan and you're looking at a Medicare Advantage plan, know that when you pick up a Medicare Advantage prescription drug plan, that penalty is going to be assessed to the Medicare Advantage plan or a standalone prescription drug plan, either way. We're going to be following up on some other tips and important facts about why you need to have somebody guide you through Medicare. Guys, if you want, click on the link below to be able to get the Medicare Made Simple video and the guidebook that we provide. It's a great educational resource. We also have other content, or you can always schedule a time to talk to one of our licensed agents here in the office to walk you through and provide the proper guidance and answer all these difficult questions about Medicare that you may be having. Until next time, I'll see you on the other side.